Hello there and welcome back. It's very, very fiery on set this afternoon. Benga and Olive trying to go to the courtroom on set. But, you know, definitely, I'm sure everything's at peace right now. All right, we have our guest right now. It's Health Tuesday today, and we have our wonderful, wonderful guest this afternoon. We have teased her, we have talked about her. She's not a stranger to the show. She's a part of the family indeed. She's gone on a good surgeon, and she's back now looking even more beautiful. Don't be fooled by her good looks. She's a qualified medical doctor, and today she'll be speaking to us on healthcare management in Nigeria. Please make very welcome Dr. Kemi Ezenwanne. Hello, Doctor.
It's good to have you.
Nice to have you, Dr. Kemi.
For the first time since you became a mother on our set. We just had to put that out there. Okay. How are twin boys?
They're fine. It's so good to have. It's so good to be here.
Yeah.
It's so good to be here. I mean, when I walked into the studio, it was just very nostalgic for me. I was like, oh, I've missed being here and you know, being on air and just seeing your lovely faces. And I'm just so happy and so honored that you would have me on your show.
Oh, the honor is ours, to be fair.
We're glad to have
Now, you've been through, or at least you went through the, not just being a healthcare professional yourself, you've also been through the system in the past 1 year. How was the experience for you from a personal perspective before we even go to a statutory perspective?
Okay, so for me, you know, sometimes when you're in a system, you can't really see or appreciate the system until you step back and look at it from a wholesome perspective. So I was a patient, you know, and I went to the hospital. I was in a lot of pain. And when I got there, I was seen by a doctor. And after I was seen by the doctor, they prescribed some injections I was supposed to take. And then after I had the injection, it was in the middle of the night. The nurse was like, okay, so you have to go. I hope you are not. She put it like I was disturbing their sleep. It was around 12 midnight, so I was rushed in there, you know, and she was like, so we've given you the injection and you need to go. And then I left. And the pain brought me back the next day. And after we consulted, I spoke with the doctor in charge, and, you know, we both agreed on what I would take. And then she said, oh, you would need to be admitted for at least 24 hours, so we'll just monitor and observe you. And then I went out to meet the nurse. And as soon as she saw it, she's like, you have to drop a deposit of 200,000. And I was like, what? You know, and that was like, you know, a shocker for me, you know.
It was a private institution.
It was a private institution. So she said, you have to drop a deposit of 200,000. I was like, 200,000 for a 24-hour admission. She's like, that's our policy. You know, I went to speak with the doctor, and the doctor was like, and what? She said that, you know, and then she went to try to talk to them, and she came back and she was like, I'm sorry, there's nothing we can do. And then I left because I was like, no, there's no way I'm paying 200,000 naira to stay on bed for 24 hours. And that was when, so, you know, I called a couple of friends, and then I went to one of them's clinic, and then eventually we went to a federal institution, and, oh, they were like, oh, a doctor is coming, you know, and they took proper care of me. And then I now started asking my friend, I was like, is this how this place is? She was like, no, it's just because you're a doctor. Because I remember the consultants would call and say, oh, go and check the doctor in room, so, and the doctors would be telling them that, oh, we're in her room, you know. And that was when I understood that when you're a patient, it's not funny. The healthcare system is, there's a whole lot, you know, that has gone with the healthcare system. It's a failed sector, you know. When you look at the fact that the budget for 2018 is 3.9% of the entire annual budget. And that's as opposed to last year's budget that was 4.2%, and 2016's budget that was 4.1%.
So it's getting...
So it's reducing, and now the
problems are increasing.
Yeah, the problems are increasing. And the funny thing is the African Union states that every country should have 15% allocated of the entire annual budget to health. So we're having 3.9%. Now, if we're looking at the entire, if 341 billion naira is what we are taking 3.9% from, that means every citizen has 1,888 naira for the whole year. Now, what can that get you? It can get you nothing. And so it's a failed sector, and when you look at the challenges, there's inadequate funding and there's capacity, there's a problem with capacity.
And talking about capacity, I mean, it's been highlighted recently that there's a huge brain drain in the country, not just in the health sector. A lot of healthcare professionals are looking for better opportunities in other climes. What do we need to do to keep the talent here? Because I know that is also a problem facing the healthcare industry, and we're still happy that you're here.
And we're not quite
For
sure
now.
that exactly. I was going to add, we're not
now.
quite sure she'll be here for a long
For
time.
now. So for that, the challenge with that is, so, you know, with medicine, you graduate from school and you're excited. I remember when we were in medical school, you know, we're so excited, I'm going to be a doctor. And they're like, our consultants will tell us that you're at the bottom rung of the ladder. Like, once you come out, you know, you're no longer a medical student, you're just a medical doctor, a house officer, you're like a rugrat at the bottom rung of the ladder, because you have to keep updating yourself, writing exams, doing your residency program. I mean, I would not want to be 10 years post-medical school and they're like, oh, so what's your specialty? I was outside the country, and every time I was introduced as a doctor, they're like, oh, okay, so what doctor are you? I'm like, so right now, you know, I'm still in general practice. I'm still planning to do my residency. Because outside the country, you're not recognized, in quotes, as a doctor until you have done your specialty. And so it's, oh, I'm a pediatrician, or oh, I'm an eye doctor or something, you know. So the challenge we're having with that is we don't have the facility to train the doctors. We have a lot of doctors that are being pumped into the system. And many of them would write their exams. Their exams have a validity of 5 years. And in 5 years, you'll not even be able to get into residency training. I have a friend that her 5 years validity, the validity for her 5 years exam, it expired. And so 5 years passed, and she had not gotten into the system. And she was like, look, Kemi, I'm just going to go to Balogun and open a shop. Because at this point,
Man, we're just looking at the healthcare professionals. We're looking at the the problems facing. So we've not even come to hospital management. We've not come to drugs. We've not come to patient administration and all of that. So when you look at this, it's a crisis situation.
And it's not, you're not surprised that it's reflecting with the maternal mortality rates, the child mortality rates. I was looking at the recent statistics before I came on here, and maternal mortality rates generally refers to it's the fact that out of every 100,000 women, you know, how many women will die? And so in Nigeria, we have over 800 women dying out of 100,000. In Ghana, it's 368. In the US, it's 14, and in the UK, it's 9. So you can see that there's a wide gap. It's a wide gap. And this is even, trust me, this is an improvement from where we're coming from. Now, for child mortality rate, it says that out of every 1,000 children that are born, how many of them will make it to their first birthday? So in Nigeria, you have 108 children out of 1,000 children dying. In the UK, it's, I think, 4. In the US, it's 9, something like that. And then in Ghana, it's 60-something. So it's, you know, it begs, you know, the government. So I'm not here to put the entire blame on the government, but everybody needs to wake up. We need to change the policies. There's so much. I mean, I'm not, and you know how it's everyone is saying, oh, so if we all run, how would we, how would we fix it? But for me, I'm like, if you don't get better training, if I'm not exposed outside the country, when you walk into a hospital,
you'll be the one-eyed king and a local champion.
Exactly. When you walk into a hospital, they are not thinking, drop deposit, madam.
It's not money that is driving.
In fact, it's written on the wall that no money should be taken. They're not thinking money.
Saving
we need to save the life of this woman and her baby. That is the most important thing to them. And then they will discharge you, you will go home, and then the bill is waiting for you, maybe just a few days later. And you are not running anywhere. You can't run anywhere.
Whereas that's a totally different case.
But that's a total different case. So for me, I was talking to a couple of people, and I'm like, there has to be a system. Because irrespective of who comes into government or who goes out, there's a system that works outside the country. And the same thing happens here. And so I'm not looking at, oh, the president, 2019 elections are coming, they'll make so many promises. There is a system. If we fix the system, irrespective of who comes or who goes, who comes with good or bad leadership or who goes, the system would work. And so if the system is bad, no matter the promises that are made, how do you,
let's talk about the individuals now. We've focused on the government and we've reached a conclusion that that is not working on one hand. I worry sometimes about the quality of service we get from hospitals. Now, we know that, yes, a lot of them are upset because they're not getting as much. We've mentioned about how not enough has been allocated to the healthcare sector in the 2018
welfare
budget.
remuneration.
Now, let's talk about the attitude of medical personnel. You talked about how this nurse treated you poorly. And that's not, a rare case. It's something that we see all the time.
That's
So I think we should ask,
things.
what kind of training do they get, in schools, in universities? Why do nurses, first of all, tend to be very, very mean to patients?
Particularly pregnant women
And
who are giving birth.
are there not
horrendous
regulators?
stories.
Are there not
Are you
regulators?
enjoying it when he was doing it?
Yes.
Why you shall
And they
open your
slap
leg?
people.
They will slap your
They
legs.
slapped my
Open,
friend's sister. Open your leg. And once they even told her, better be praying, there's no bed. Better be praying that people that are inside will give birth before your baby comes out so that you see bed to use.
Is there no consumer
insensitive.
protection agency or like a body that regulates the
That
activities?
regulates that.
Like the Nigerian Medical Council. And,
So yes, you have you have the Nurses Council, you have the Pharmacy Council, you have the medical, the NME, you have the MDC, and you have all these councils. But the thing is, so for these practitioners, now, to be honest, outside the country, a doctor is entitled to, a doctor should see, I think, 5, 6 patients. They have their time, the times that, you come, especially if you're going for a clinic, you have your appointment already set up. And so even if you call and you're like, I need a 10 a.m. appointment to see this particular doctor, they're like, no, come for the 10:30 or maybe 11 o'clock. But here, you have one doctor or one nurse attached to so many patients. And so many of them are tired. Many of them have not been paid. Many of them are just working, let's just go to work. Some of them are even really passionate about it, but they've been overused. So to a large extent, I would like to be empathetic with them, because I know how many times especially when I was a house officer, I would be walking around the clock, and there will still be a lot of patients that have not yet been seen. So I think for that, but then it's just a whole lot. I don't know exactly. The truth is, when I look at all the problems, I'm like, how do we fix this?
That's
the
next
million-dollar
and
question.
final question I was going to ask you. With regards, you mentioned that it's a failed state. That's a strong state, a big statement. But with what's on ground, it's not difficult to see that it's true. What would you say? You said we should fix the system. What would be some of your recommendations to fixing this system? Yeah. Yes, immediate steps and even long-term steps. So immediate steps, immediate quick wins, and then long-term steps that it can be taken, because this is frightening. But what can we do for the Nigerian health sector that could work?
I was thinking about this question, and irrespective of the income, our take-home, everyone's take-home at the end of the day is different. So how can everyone have access to good health care, irrespective of their income or economic status? I think the very important thing, insurance, if we can work on the insurance, because we've started it here, but then, the HMOs. But then I remember the drugs we would give when the drugs were like, NHS, NHIS. Oh, okay. In fact, I remember I used to advise my patients, when I look at them and I'm like, I think this person can afford, I'm like, see, please, those drugs, I would not advise you to use them, because I noticed that I would use the insurance drug to treat malaria again. The patient will come again 2 weeks after the same symptoms, 2 weeks after the same symptoms. But when I'm like, okay, go to a good pharmacy, get this malaria drug and treat it. And I would, so I usually even started advising them. So I think if we work on the insurance, because that's what works outside the country.
Yes.
Insurance.
Where there's no
I'm not even
service.
talking to you. I'm talking to the insurance company. So if we get to a point where we make sure that everyone has insurance, and then the insurance works, I think that would be a huge step. And then apart from that, it's so funny that the Minister of Labour, about 3 or 4 of the current ministers are medical doctors. And for me, I'm like, these people know, they understand, so why are we not saying anything? I think we need to work on people going more into politics, changing the health policies, and making sure that these policies are followed through.
Wonderful.
I think
we have so many
so much.
questions for you, so many. So perhaps we'll continue this discussion, because it is something that we need to certainly talk about. Thank you so much for talking so brilliantly on this topic. Thank you very much, Dr. Kemi Ezenwanne. Unfortunately, this is where we call it a day. Thank you very much for tuning in. Thanks, a big thank you to our guest, Dr. Kemi Ezenwanne.
Thank you very much, Dr. Kemi.
If you have questions you'd like to ask her directly, or you listen to some of the things she said and you want to pick her brains, or perhaps want to, rub minds with her, follow her at the Dr. Kemi on all social media.
And to see her.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love her.